Hello everyone, this is Dr. Mohamed Bukhari. I will speak today about thyroid cancer. I will speak about epidemiology, red flag signs and symptoms of thyroid cancer, diagnosis and management. Let me to speak about the thyroid gland. It is a small gland which is a butterfly-shaped gland located in front of the neck. And this gland is essential to our body because it produces some hormones that are essential to our body. And the term goiter is used to describe any enlargement of the thyroid gland. Regarding epidemiology of thyroid cancer, the thyroid cancer is relatively uncommon compared to the other cancers, but now the incidence is continued to rise worldwide, and the prevalence of the malignancy is 4 to 6.5% in USA. And this thyroid cancer considered is the fifth most common cancer in the woman in USA. And it is estimated more than 62,000 new cases occurred in men and women in 2015. And in UK, according to the Cancer Research Statistics, it is considered as 20th most common cancer in UK, and it is around 17 most common in females, and around 3,900 new cases of cancer cases detected every year. So what are the risk factors to have or to develop thyroid cancer? The age, the cancer usually occur at any age, but the common one is between 25 to 65 years. And the risk of thyroid cancer is increased earlier for women, which is in their 40s and 50s, than in men, which in their 60s or 70s. And it is more common in females, which is 3 times more common than male. Also, radiation exposure, especially during childhood, if there is exposure to the radiation to the neck or chest area. Presence of the family history of thyroid disease like the autoimmune thyroiditis with inflammation in the thyroid gland, or presence of family history of thyroid cancer, it increases the risk of cancer. Genetics also play a role. Certain inherited diseases that increase the risk of thyroid cancer, like presence of the medullary thyroid carcinoma, this is a type of the thyroid cancer. If it is present, so there is a risk of having a cancer, and presence of other diseases like or problems like multiple endocrine neoplasia type 2 and familial adenomatous polyposis. These are the problems affecting the gut or the colon. And lack of iodine in the diet increase the risk of certain thyroid cancer. So the iodine deficiency, it is one of the risk factors. Certain thyroid conditions, like having a history of goiter or certain types of the benign thyroid condition, it can increase the risk of thyroid cancer. And also obesity is considered one of the risk factors of thyroid cancer. And here there is a table dividing the risk factor to the high risk, low risk. And the high risk, which is a more important, the exposure to the radiation and the presence of the inherited diseases, like what we mentioned in the family. So it can increase the risk of especially the medullary thyroid cancer. So what are the symptoms that we can experience in the thyroid cancer? Thyroid cancer may not have any symptoms in the earlier stage, and you may not notice that you have even any swelling in the thyroid until your doctor discovers it during the routine medical examination. Or sometimes, whenever your doctor did a scan for your neck for any other reasons, at that time it can be detected. Sometimes the glands can enlarge it, and it can be visible as a lump in front of the neck. And this occurs when the tumor grows. But it is important to know that you will likely want to check by your doctor if you notice that neck lump it is large or hard, or there is pain or discomfort, is more worrisome. And if you notice that the lump is fixed and rapidly growing, difficulty in swallowing, difficulty in breathing, also because it can press over the windpipe. Also presence of the pain while swallowing, or change in voice, hoarseness of voice. So these are some risk factors that you should be aware about. Presence of neck lump does not mean that it is only thyroid cancer, because we have other possibilities that it can present as a neck lump. So it could be a benign tumor, which you call it thyroid adenoma, which is not cancerous, and it is not as serious unless it sometimes it can cause, because if it is become larger in size, it can compress, and sometimes it can produce excess hormone causing hyperthyroidism. The other possibility, it can be a cyst, thyroid cyst, which is a fluid-filled cavity, which is usually non-cancerous, but rarely it can have or contains a cancerous component. Chronic inflammation, like the condition called Hashimoto thyroiditis or Hashimoto disease, which is a recent enlargement of the thyroid gland, and it is usually associated with hypothyroidism, which is an underactive thyroid gland. Sometimes there is the neck lump, it can be related to the multinodular goiter. So it can be caused due to iodine deficiency or other thyroid diseases. And the presence of multinodular goiter, this means that there are small lumps within the goiter, and it can cause excess hormone production, and it can cause hyperthyroidism along with neck lump. Iodine deficiency, it is important because lack of iodine in your diet can sometimes cause thyroid gland to develop thyroid lump or nodule. And one of the possibility that our talk today is thyroid cancer. So we need to be aware about the symptoms of excess production of hormones, which is hyperthyroidism, and the symptoms of hypothyroidism, which is that the gland is not making enough thyroid hormones. So we'll start with the hyperthyroidism, which is a hyperactive gland. So it can cause loss of weight, palpitation, it can affect the sleep, muscle weakness, and being nervous or irritable. And the symptoms of hypothyroidism, which is that the gland is underactive and not producing enough hormones, that it can be the following: feeling cold, feeling tired, dry skin, memory problems, depression, and constipation. What are the types of thyroid cancer? We have different types, but the commonest one, it is the papillary carcinoma, and if you can see here, the percentage is around 80%. And the second one, it is follicular carcinoma, and the third one, medullary carcinoma or medullary thyroid cancer, and which is the fourth one, undifferentiated anaplastic carcinoma. And there are some rare cancers can occur in the thyroid gland. We call it lymphoma or squamous cell carcinoma. How we can diagnose thyroid cancer? If there is neck lump, so sometimes the cancer cannot be diagnosed only by the symptoms. So we need to do some further investigations. And most of the thyroid lumps or thyroid nodules are slowly growing, and sometimes it can be very small, which is detected by chance. And although most of the thyroid nodules or the thyroid lump are not cancerous, and sometimes it cannot cause a problem, and the aggressive cancer, it is rare, but it is important to evaluate for the possibility of cancer if we found any neck lump or neck swelling. And how to investigate? We need to do thyroid function test. This is a blood test that we'll do. And another important test that we need to do the ultrasound imaging to the thyroid gland. And also, if this the thyroid function test we did and we found the low TSH, so here we can do a thyroid scan. And the other important investigation that we can do, it is to take a biopsy or a small tissue from the gland. We call it fine needle aspiration cytology. And this will help us to see the risk of cancer, because when we do the fine needle aspiration cytology, so this will help us to diagnose the cancer. And when we do the biopsy, we need to test this tissue under microscope and there are different classifications that it will help us to see the risk of cancer. So we have Thai classification and statistical system classifications. So these are the classification. It helps us and to guide to report the thyroid cytology specimen. So if we look to the Psi classification, so we have from Psi 1 to Psi 5, and Psi 1 it is non-diagnostic, and Psi 2 it is non-nebulastic, Psi 3 A it is possible neoplasm, and Psi 4 and Psi 5 these are the most important because they are suspicion of malignancy in Psi 4, and there is risk of malignant in Psi 5. When we use a persistent system classification to report the finite aspiration cytology, so we have 6 classes. Class 1 it is non-diagnostic, class 2 it is benign, class 3 it is ATP of antidetermined significant, class 4 it is follicular neoplasm, class 5 it is suspicion of malignancy, and class 6 is malignant. So if we see the two reporting systems, so the Psi 4 and Psi 5 it is important, and here Psi 5 and Psi 6 in the persistent system because they are suspicion of malignancy and the malignant risk. And if you can see here, according to the class, the risk of predicted thyroid cancer. So with class 1, the risk of cancer it is less from 1 to 4%. With class 2, it is 0 to 3%. With class 3, persistent system classification, so from 5 to 15%. And the risk increased from class 4 to class 6. For class 4, it is 15 to 30%. For class 5, it is 60 to 75%. And class 6, which is a malignant, the risk of malignancy increased from up to 99%. How to manage the case with thyroid cancer? This will depend on the stage and the type of the thyroid cancer itself. And the options of the treatment available are surgery. And if they remove the gland, this means that the gland producing hormone, it will be removed, and you need to take the thyroid hormone replacements for the rest of your life. And the other option it is radiation therapy and chemotherapy. The differentiated thyroid cancer that we mentioned before, which is either papillary or follicular thyroid carcinoma, they are most frequent one, as we saw in the percentage, and usually when treated by the standard treatment options, which is the surgery, plus or minus radioactive iodine therapy, the treatment usually is effective. Regarding the medullary and anaplastic types, so these are the rare subtypes, and it need to be treated by the expert physician to treat such malignancies. And there are new treatment now available, which is called a targeted treatment, especially for the differentiated cancer, which is papillary and follicular and medullary thyroid cancer. And this treatment, it helps to prolong the progression of the free survival, and although it is not curable, but it will help to, especially for the patient with progressive disease or symptomatic patient, or those patients when the above treatment like the surgery or radioactive iodine therapy it is not effective. So these people, they can be a candidate for targeted therapy. Example of the targeted therapy, it is kinase inhibitors. Kinases are a protein inside the cells that normally relay signals, like telling the cell to grow. And when we block these kinases, so this will help to treat cancer. And an example for that, it is lenvatinib, which can be used as a targeted therapy for thyroid cancer. Thank you.